Hello, today we'll be discussing about Parkinson's disease. Parkinson's disease is a progressive neurodegenerative disorder characterized by motor and non-motor symptoms, primarily due to dopamine deficiency in the basal ganglia. So it's a neurodegenerative disorder which is progressive, characterized by motor and non-motor symptoms due to deficiency of dopamine in basal ganglia. Coming to pathophysiology, first, it's a neurodegenerative disorder of dopaminergic neurons, occurs primarily in substantia nigra pars compacta, leads to reduced dopamine in striatum, impairing motor function. Second, protein aggregation. There is misfolded alpha-synuclein aggregates into Lewy bodies, which disrupt neuronal function. Secondary mechanisms involve oxidative stress from dopamine metabolism, mitochondrial dysfunction impairing energy production, neuroinflammation from active microglia. So, pathophysiology involves degeneration of dopaminergic neurons, and it occurs primarily in substantia nigra pars compacta. And there is protein aggregation, basically misfolded alpha-synuclein aggregated into Lewy bodies. And secondary mechanisms involve oxidative stress, mitochondrial dysfunction, and neuroinflammation. Now, coming to syndromes and named phenomena in particularly in Parkinson's disorder. So the first one is Hoon and Yar stages. I hope I'm pronouncing it correct. And this is the classification of Parkinson's disease progression from 1, that is unilateral involvement, to 5, that is wheelchair bound or bed bound stage. And there is this on and off phenomenon where there is fluctuations in motor symptoms due to levodopa therapy. On refers to periods of good mobility and off indicates worsening symptoms. And the third phenomenon is freezing of gait, where there is sudden inability to initiate or continue walking, often triggered by tight spaces or stress. The fourth one is Lewy body dementia, where there is overlap syndrome with prominent cognitive impairment and visual hallucinations. Fifth one is DAT scan phenomenon, where dopamine transporter imaging shows reduced uptake in basal ganglia, aiding in Parkinson's disease diagnosis. DAT scan phenomena. So there are 5 named phenomena associated with Parkinson's. One is Hone and Yar stages, where there is they have classified the PD into stage 1 to 5. 1 is unilateral involvement, to 5 which is wheelchair bound. On and off phenomena, freezing of gait, Lewy body dementia, DAT scan phenomena. Coming to diagnosis, basically it's a clinical diagnosis based on history and physical examinations. Supportive imaging are DAT scan, where it shows decreased dopamine transport uptake in the basal ganglia, and MRI to exclude other causes like vascular Parkinson's. Next, let's see the genetics which contributes. So we have a mnemonic here. The mnemonic is Park alpha mutants dance lazily. So Park alpha dance lazily. So P for Park 1-4, and the mutation is in SNCA, that is alpha synuclein. This is the first discovered misfolded alpha synuclein aggregates into Lewy bodies. Second is A for Park 2. A for autosomal recessive, impaired proteasomal protein degradation. And third one is R for Park 7, DJ1. And C for LLRK, leucine rich repeat kinase. This is the most common genetic cause of autosomal dominant Parkinson's disease. So all these, first Park has Park in it or arc in it, and P for Park 1-4. The first one, that is alpha synuclein, is the first discovered, and misfolded alpha synuclein aggregates in Lewy bodies. Park 2 is a autosomal recessive form, impaired proteasomal protein degradation. And the C, which is the most common genetic cause of autosomal dominant Parkinson's disease. So LARC2 is important. and Park 1-4 is the first discovered, and Park 2 is autosomal recessive. Now, alpha GBA mutation, that is glucocerebrosidase mutations associated with early onset Parkinson's disease, reduces lysosomal function. This second one is VPS35, is vacuolar protein sorting 35, rare cause, affects endosomal trafficking. And the last one is pink one, Petin induced putative kinase 1, involved in mitochondrial quality control associated with autosomal recessive form. Coming to clinical features, the mnemonic is trap. The first one is trimmer, resting trimmer, which is a pill rolling trimmer improved with the voluntary movement. The second one is R, rigidity. It's a cogwheel or lead pipe rigidity due to increased muscle tone. A for akinesia or bradykinesia, slowness of voluntary movement. And P for postural instability, impaired balance and frequent falls, especially in advanced disease. Coming to non-motor symptoms, we have a mnemonic of dramatic loss. That is DRAMATIC. D for depression, R for REM sleep disorder, A for autonomic dysfunction, M for memory impairment, A for anosmia, T for tiredness or fatigue, I for impulsive control issues, C for cognitive impairment. So these are the motor and non-motor symptoms. Now coming to treatment, we have a mnemonic for treatment as well. The mnemonic is dopamine makes stiffness go away quickly. So the first one is dopaminergic therapy, which includes levodopa plus carbidopa, wherein it replaces the dopamine. Carbidopa inhibits the peripheral breakdown of dopamine. B is MAO-B inhibitor, selgilin and rasigilin. It inhibits dopamine breakdown in the brain. Third one is dopamine agonist, pramipexole and ropinirole. It stimulates dopamine receptors directly. It's used in early Parkinson's disease. And the fourth one is COMT inhibitor, entacapone and tolcapone. It inhibits peripheral levodopa breakdown, prolonging its action. A for amantadine. Amantadine enhances dopamine release and reduces dyskinesias. Q for anticholinergic, trihexyphenidyl and benztropine, used for tremor. Even side effects like confusion. And the surgical treatments involve deep brain stimulation, wherein the electrodes are implanted in the subthalamic nucleus or globus pallidus, improves motor symptoms. Effective in reducing motor fluctuations and medication side effects. Coming to emerging therapies, we have gene therapy targeting genes like GBA and SNCA to reduce alpha-synuclein toxicity. Stem cell therapy, wherein transplant of dopaminergic neurons to restore motor functions are tried on clinical trials. The third one is exenatide, that is a GLP-1 agonist, reduces neuroinflammation and oxidative stress, which is usually used in diabetes. It has shown some promising results in small trials. Fourth one is alpha-synuclein vaccine. It stimulates immune clearance of toxic alpha-synuclein aggregates in early clinical trials. And the fifth one is focused ultrasound, where we use a non-invasive targeted therapy for tremor reduction. It's an FDA-approved treatment for tremor-dominant Parkinson's disease. So, thank you.